Ladies and gentlemen, I'm sitting here with Dr. Brent Tucker, and he's a pediatric dentist, been practicing what, 9-10 years?
Yeah.
Okay, so he's joined us at Kids2Dentist, and today he's here doing some IV, GA, and taking care of a lot of the larger treatment and so forth, working with the anesthesiologist. And I just wanted to get you to give him a chance to introduce himself and what he does and why it's such a needed thing in a community like this here in Central California.
Well, nice to meet you guys. Like Dr. Lanier said, I'm a board certified pediatric dentist. I have been for quite some time now. I was working out in Los Angeles for all these years, and am coming up here to the Central Valley to do some work with Kids2Dentist.
And he's been very beneficial for our GP doctors that are doing pedo and helping them. And especially one of the things, the first thing he said was we need to standardize our diagnosis. And that is so true, knowing how to diagnose and so forth. And because when he comes in and he's doing the larger treatment cases, we don't want any conflict with the parent saying, well, one diagnosis this way and another is saying that. So we've been working on that, but also we've been discussing doing some training for the community doctors, some other GPs. So doing a CE credit course for our CE credit. Now, what do you have in mind, Doc, as far as doing the training for GPs, pedo for GPs?
Yeah, so I think we're going to do a little mini series, set of courses, maybe some Saturday mornings or afternoons, and talk about just some common pediatric cases, common treatments, and how to make sure that we have predictable results every time.
Yeah. Working with GPs, what would you say is one of the main points that you think you need to stress as you're doing the training with the GPs? What are some of the things that you think are top of your list that you'd like to get across?
Definitely making sure they do the treatment the same way every time. Knowing the differences in the different materials. We use some materials in pediatrics that may not be as widely used in general dentistry, and so making sure that we're using each material the correct way so that we get optimal results. I think that's the big thing. You know, I think most children will be treated by GPs, and it can be done so very safely and effectively. We just need to make sure that we're using everything and doing everything the correct way.
Yeah. And that is a big part of standardizing. There's a lot of ways to do almost anything, but there's probably one or two right ways you can do it. And the main thing is getting the good results. And since he's the pediatric dentist with the most experience in our organization, he's now become the clinical director. So everyone will kind of follow his diagnosis and treatment planning, and therefore everybody, whether they're there to do the treatment or not, the diagnosis is still the same, the treatment planning is still the same. It's easy for the next person to step in and go ahead and do the work. So we want to welcome you aboard, Doc, and I appreciate everything that you're doing.
Yeah. Thank you. I'm glad to be here.
And just speak about today when you have the anesthesiologist. How beneficial is that for these tough cases, the big cases?
Well, it's definitely super beneficial. You know, not every child is either old enough or ready to do all their treatment. Sometimes we have a lot of work that needs to be done, and many times, you know, if we're doing 3 or 4 dental visits, the kids will just be traumatized by the time they get to that last visit. So, you know, being able to use the anesthesiologist and do all their treatment and get them out of pain, get their infection taken care of, and, you know, they don't necessarily remember what occurred here today, and then we can like focus on getting them a dental home and getting them in regularly so that we can grow a good relationship with the child. You know, just because they came to us in a certain state doesn't mean that they need to leave us in that state.
And I like that about the anesthesiology. It leads them to a point where they don't remember anything, so they're not traumatized and they can come back. So even if you have to do extractions and bring them back for spacers or something, then they don't remember, so they're not traumatized by the other thing. And now for something small, they can just come back and get the other thing done.
Exactly.
Yeah.
You know, if we can get them early and, you know, have good beneficial dental visits, and they can be happy to come and be, you know, lifelong good oral care, that's what we want, you know. But when they come in and already have infections and lots of treatment needs, you know, sometimes we just need to do a quick reset, and then we can go from there and start making sure that they have a great experience going forward.
I appreciate you having you on, Doc, because you do so much. He brings a lot to the table, guys. So listen, if you're a dentist or you're a GP and he's going to be doing these classes, I'd like for you to attend and just find out more about it. And because I'm a GP, I started doing pediatric dentistry. God, it's been about 35 years now. Almost 40 years. Damn. 40 years. 40 years ago. But I appreciate having specialists. Like I said, I'm a GP. I started working with some specialists doing pediatrics, and then I just fell into just doing it. But anytime that you get a chance to have someone as competent as someone like Dr. Tucker is, then you want to make sure that you come listen to what he has to say, and we're good contact. And if you want to refer your patients over, let us know. We had him and the anesthesiologist come in, do the big cases. If you want to see the patient back, we send them back to you. So it's a great thing. We can handle that, whatever you'd like to do. But get definitely the more you know, the better it's going to be for you and for your patients, and the whole thing of referring, when to refer and how to refer. So we look forward to seeing you at some of these CE courses. Going to give some CE credits as well.